months, there has been a lot of discussion about COVID-19 disease and the related aspects. Questions, 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 but where is the answer? बहुत टाइम से सुना है कोरोना वायरस क्या है, COVID-19, what is pandemic, origin, transmission, differences, symptoms and diagnosis. Let us try to learn. Coronaviruses are the group of RNA viruses that cause diseases in mammals and birds. In humans and birds, they cause respiratory tract infections that can range from mild to lethal. In mild, from common cold to lethal, that is MERS, SARS, and the latest COVID-19. And in other animals, they cause different type of diseases that there are yet no vaccination and antiviral drugs discovered to prevent infections. जैसे कि अभी भी COVID-19 की कोई वैक्सीनेशन या एंटीवायरल ड्रग्स अवेलेबल नहीं है. They are largely spherical in shape. They are enveloped viruses with positive sense, single-stranded RNA genome. They have characteristic club-shaped spikes projecting out from the surface, giving a shape of solar corona, thus the name coronaviruses. As you can see in the picture, surface पे spikes हैं, जो कि resemble करते हैं corona-like structure, thus the name coronavirus. The viral envelope is made up of a lipid bilayer in which the membrane M, envelope E, and spikes S structural proteins are embedded. What is COVID-19 disease? It is an infectious disease caused by the recent known coronavirus. It is the new respiratory virus which gets spread mainly through the droplets generated when the infected person coughs or sneezes, or by the droplets of saliva or discharge from the nose. As you can see in the picture, everyone is preventing or everyone is protecting themselves from getting infected. In humans, several coronaviruses are known to cause respiratory infections ranging from mild cold to severe respiratory problems such as Middle Eastern Respiratory Syndrome, MERS, and severe acute respiratory syndrome, SARS, and the latest coronavirus, COVID-19. The most recent coronavirus caused coronavirus disease known as COVID-19 disease. Novel coronavirus cases have been confirmed in large number of population by WHO on March 2020. Now, what is pandemic? Pandemic is defined as an epidemic occurring worldwide, that is, crossing the international boundaries and also affecting large number of population. अगर कोई इन्फेक्शन या कोई डिजीज एक लोकल एरिया में होता है among many people, उसको बोलते हैं एपिडेमिक. Crossing the international boundaries means same infection, same disease, particular area से spread होते हुए country to country, nation to nation spread हो गई हो. जैसे कि case started from China और अभी पूरे world wide जो है इसकी occurrence है. First case, Wuhan, China. The Yunnan seafood mining city of Wuhan, believed by many to be the origin of COVID-19. It is not confirmed yet, but many believe that the first case was from Wuhan, China. In December 2019, a pneumonia in Wuhan, China. On 31st December 2019, the outbreak traced to a novel strain of coronavirus, which was given the name COVID-19 by WHO. COVID-19 means Coronavirus Disease 2019. Origin of COVID-19 is not confirmed yet, but it is believed to have a zoonotic origin and has close similarities with coronaviruses of bats, suggesting it emerged from bat-borne virus. But there is no evidence of an intermediate animal reservoir. As you can see in the picture, it is believed that coronavirus, that is COVID-19, is emerged from bat-borne coronaviruses, but in daily routine, there is no relationship of bat and human. So there must be an intermediate reservoir, but it is not known that who is that reservoir. WHO has declared that it is not a cat or nor a dog. indicates that if a person does not protect himself, if he is infected, he can spread the infection among the other people. But whereas if he provide himself good care and take, then he can prevent the chances of spreading the coronavirus infection or any type of disease by wearing masks, etc. Thank you.
Individual of the same generation. It could be in the form of direct contact transmission. In direct contact transmission, it may occur through direct contact with virus-contaminated objects or surfaces of infecting people through their mouth, nose, or eyes. Aerosol transmission. This could be from even asymptomatic COVID-positive patients. The aerosols remain in air for at least 3 hours. Nosocomial transmission, also called hospital-acquired transmission. Healthcare workers are at serious threat from this kind of transmission. In this mode of transmission, it may occur through respiratory pathway. It may occur through any procedures on respiratory pathway like incubation, dental care, and ICU management. Droplet transmission. Droplet transmission can occur from a person who sneezes and coughs without any face covering, and these droplets may remain in air and may be ingested or inhaled by healthy people. As you can see in this picture, through coughing and sneezing and through contaminated hands, people can pass the COVID-19 infection to healthy people. For how many times COVID-19 virus can stay alive or active on non-living things? Talking about aluminium surface, it can stay active for 8 hours. On cardboard, it can stay active for 24 hours. On plastic and stainless steel, it can remain active for 3 days. And on wood and glasses, it can remain active for 5 days. Fecal-oral transmission. The role of feces in transmission of COVID-19 is not completely known yet, but there are some evidences that suggest the GI system is a critical route of spread of virus. As we know, COVID-19 virus infects cells via the surface angiotensin converting enzyme ACE2. Incidentally, it is seen that there are increased expressions of ACE2 in gastric glandular cells and rectal cells, which shows the evidence of fecal-oral transmission. In study, it is also found that feces of recovered COVID-19 positive person may contain viral RNA, although he is negative for respiratory secretions. Transmission through surgical operations. Until beginning of 2020, there was no cases of transmission of COVID-19 from patient to surgeons during their surgical operations. But later on, it was confirmed by Chinese Center of Disease Control and Prevention that 3.8% reported cases were healthcare personnel, from which 15% cases were severe with 0.2% mortality rate. Vertical transmission. It is the important mode of transmission to understand. Vertical transmission is the transmission from pregnant mother to their infants. First case of possible vertical transmission was reported in March 2020. But interestingly, amniotic fluid, cord blood, and breast milk of mother were negative for virus. Not units of 19 positive mothers acquired the disease, but still, this mode of transmission should not be ruled out. As you can see in this picture, different modes of transmission. Transmission through coughing and sneezing, respiratory droplet transmission, contact transmission, aerosol transmission, and vertical transmission. Stages of transmission. According to WHO, there are 4 stages of COVID-19 transmission. Stage 1 or imported stage. They are those cases who travel to virus-hit foreign countries and now have come back to their home country. Local stage transmission. They are those cases who come in contact with patient who had a travel history or who live in the same house with the patient. Community transmission. Community transmission is the stage of transmission in which those people get affected who doesn't have any travel history and who are not even in contact of any COVID positive patient. In community transmission, large number of people get affected, and in community transmission, it is also difficult to trace कि infection हुआ कैसे है जो patient है उसे. Epidemic stage. It is the end stage. Rapid transmission occur in large number of people within a short period of time, which is most of the countries facing nowadays. In this picture, as you can see, imported case जहाँ सिर्फ एक traveler affected है, local transmission जहाँ हेल्थ केयर वर्कर्स या फिर वो लोग अफेक्टेड होने के ज़्यादा चांसेस है जो कि सेम हाउस में रहते हैं इन्फेक्टेड पेशेंट के साथ. एंड इन कम्युनिटी ट्रांसमिशन यू कैन सी अ लार्ज नंबर ऑफ पीपल गेट अफेक्टेड ऑफ अ कम्युनिटी. नाउ एज वी नो, टू स्लो डाउन द स्प्रेड वी नीड टू इंटरप्ट दिस ट्रांसमिशन. सो व्हाट वी शुड डू? इफ यू आर सिक, if your children are sick, or if someone in your household is sick, stay at home. Stay at home if you are an older people, and if you have any serious underlying conditions like diabetes mellitus and any cardiac disorder. Start work from home. If you are going outside, avoid eating or drinking in restaurants, bars and malls. Follow proper social distancing and maintain at least 6-meter distance from each other. If you are working in a critical infrastructure industry, follow proper CDC guideline to protect yourself. Avoid unnecessary traveling. And do not visit any nursing homes. It is not necessary. Use mask and facial covering. When you use mask and facial covers, it helps us to cover our T-zone, stop us from touching our T-zone again and again, and prevent us to get infected from other infected persons' droplet saliva. In a study, it is seen that countries where masks are mandatory in public places, that daily case rate decreases about 2 to 3% within 3 weeks. Why masks are so important? In a study at a salon, it is seen that 2 stylists were tested COVID positive. After tracing their 139 clients, it is revealed that all were asymptomatic. In addition, among those 139 who goes for voluntary testing of COVID-19 were found out to be negative. The reason for the virus not spreading is that both the stylist and clients were wearing masks during their interaction. What else you can do? Wash your hands often with soap and water for at least 20 seconds. Avoid touching your T-zone. Disinfect frequently used items and surfaces as much as possible. Sneeze or cough into a tissue or inside your elbow. Now over to Palak. She will discuss about diagnostic feature of COVID-19.
Palak.
Good morning to everyone. Now I'm going to discuss about diagnostic characteristics. Am I audible?
Yes, Palak.
I'm going to discuss about diagnostic characteristics. There are three major steps of complete diagnosis, and they are like as how to collect swab, what are the tests, and imaging techniques or imaging findings. So I'm going to discuss brief detailed in about all three steps. So I'm moving to the first, which is swab collection. So there are three regions from where we can collect the sample. First is oropharyngeal swab, or we can say as throat swab. Second is middle turbinate swab or nasal swab. And third is nasopharyngeal swab. So these are the requisites which are important to collect the swab. First is sterile fork swab. Second is adhesive plastic bag, which is used for disposable things. Third is pan torch. Fourth is tongue depressor, which is used in throat swab. And last is sterile transport medium. Okay, so first is oropharyngeal swab or throat swab. So in this, we ask to the patient to tilt his or her head backward, as you can see in the slide, and ask him to open his mouth, full mouth, and we put the swab into the mouth till oropharyngeal part, and we rub the swab for 5 to 10 seconds, and then we put it out without touching anything in the mouth, as you can see in the slide. The second is middle turbinate swab or nasal swab, in which we put this regular swab into the nose around 2.5 centimeter deep to the middle turbinate part, and we put it back after 5 to 10 seconds, after rubbing 5 to 10 seconds. The third is nasopharyngeal swab. As you can see, we put the swab at nasopharynx, but there are some contradictions, like we need to consult the doctor prior to collection procedure of the patient. If the patient has facial surgery or ENT conditions or epistatic condition or base of skull fracture or transsphenoidal pituitary operations or nasopharyngeal carcinomas. So these were the three type of swab collections. Now I'm moving on the tests. So what do the diagnostic tests for COVID-19 detect? Diagnostic tests for COVID-19 detect either the virus or the immune response. The viral RNA detects by RT-PCR, which detects COVID-19 viral antigen, and the immune response antibodies against COVID-19 antigen. So there are basically three types of tests can be performed. The first one is rapid diagnostic test based on antigen detection. This test detects the presence of viral protein that is expressed by the COVID-19. So it will bind with the specific antibody and generate a visual detectable signal within 30 seconds, as I've mentioned in the slide. So basically this test can be performed in acute or early infections, and the result of this test depends on time from onset of illness, concentration of virus, quality of the specimen, how is it processed, and reagents in the test. But the sensitivity of this test is only around 34 to 80%. So generally we don't use this. Second is rapid diagnostic test based on host antibody detection. Okay, so in this test detects the presence of antibodies in the blood of people, in the blood of patient, and this test can be performed in the second week, and it goes for days to weeks. But the antibody responses depends on the on patient's age, nutrition status, severity, medications, and infections. The third one and the important one is RT-PCR, which means reverse transcriptase polymerase chain reaction. It is known as gold standard test because this is the most accurate test to detect COVID-19. So this is known as gold standard test. In this test, a sample is collected, then the sample is treated within several chemical solutions that extracts only the RNA. But this extracted RNA is a mixture of person's RNA, which is patient's RNA, and viral RNA. Okay, so the RNA reverse transcripted to DNA using an enzyme known as reverse transcriptase enzyme. So after the transcription, scientists then add additional DNA that are complementary to transcribed viral DNA. So these cDNA attach themselves to target section of the viral DNA. Then this viral DNA, then placed in a mixture. This mixture is placed in a RT-PCR machine as I've shown in the slide. So the machine cycles the temperature to trigger reaction to create new identical DNAs. So the cycle repeats over and over. Each cycle doubles the previous amount. So like 2 copies becomes 4, 4 copies becomes 8, and so on. So at the end, after 35 cycles, 35 billion new copies are created. Only after 35 cycles, there will be 35 billion new copies of the viral DNA. And the important thing is, lesser the cycles, more severe the infection is. So I presented a graph. As we can see, lower the cycles, higher the fluorescence. As you can see, the left-sided graph, when the C value is lower, the severity of the infection is higher. So this RT-PCR test is highly sensitive and specific, more than 90 or 95%. So we generally use this for detection of COVID-19, and that's why this is known as gold standard test. Okay, so this is one more graph here between timing and infection, and I have shown you late antibodies, early antibodies, and viral detectable, and the bluish part is of symptoms. Now, we will see the imaging findings. Here is a chest X-ray on the left side. The most common abnormal finding is ground glass opacity. As you can see, I have circled it. So that means that some portion of the lungs looks like a hazy shade of gray. You can say it like as it looks like a frosted glass, like a window in a winter time. So it is important to note, however, that chest X-ray are not very sensitive for COVID-19. So if they are not sensitive, then they can yield false negatives. So to avoid the false negative, we go for the chest CT because as compared to the chest X-ray, chest CT gives much more detailed view, as you can see in the right picture. They represent alveoli getting filled with fluid and turning a shade of gray, which is known as ground glass opacity in the left side of image, and in the right side of image, in severe or advanced infections, more and more fluid will accumulate in the alveoli. So the ground glass opacity will progress to a solid white consolidation, in which the alveoli is fully filled by fluid. However, there is a finding called crazy paving pattern. So you can see in the image the crazy paving pattern due to the swelling of the interstitial space along the walls of the lung lobules. The appearance is similar to irregular shaped stones used to pave a street, so that's why this is known as crazy paving pattern. I have shown a diagram. So these are three: ground glass opacity, consolidation, and crazy paving pattern. Can be seen in isolation or combination in one another. We can see them separately or we can see them in one patient at the same time. So the disease severity, I have shown one more graph. The disease severity is directly proportional to the lung findings. Lesser the severity, lesser the findings, and more the findings, higher the severity and more the symptoms. And when the patient improves, there is gradual resolution. You can see at the right side, the gradual resolution of ground glass opacity and consolidation. Test CT is sensitive for severe cases of COVID, but not specific for COVID itself. So in severe cases, we don't do chest CT only. We have to do more tests. And should be performed only when referring physician feel it will impact the management, then we can use the chest CT. So the key finding of chest CT are ground glass opacity, consolidation, and crazy paving pattern. Here I have added some more things that are usually not seen in COVID-19, more reports. The first is pleural effusion. It is not that common in COVID-19 infection, but it is common in congestive heart failure, bacterial pneumonia. The second is large lymph nodes in mediastinum or hilum. It is commonly seen in other types of pneumonias. And the third is lung cavities, which is generally seen in development of bacterial and fungal pneumonias. These three are not so common, or you can say very less findings in COVID-19 infection. There are two of X-rays, original X-rays. You can see in the left or right both that the left lung, the right lung is more severely affected than the right. Right is also affected, but the left lung has very severe infection. Because we can see the consolidation, the dark consolidation in the left side. In the right too. This is the original CT. Multiple ill-defined, discrete, and confluent ground glass opacities are noted involving bilateral upper lobes. You can see in the CT, bilateral upper lobes, right middle lobe, lingual lobe, bilateral lower lobes. So many of these opacities are situated in peripheral subpleural locations. The posterior segment of upper lobe, superior segment of lower lobe, lateral vessel segment, and posterior vessel segment of lower lobe were the most frequently involved site in COVID-19. Lung opacification mainly involved the lower lobes in comparison with middle upper lobes. No significant differences in distribution of the disease were seen between right and left lungs. The individual scores in each lung as well as the total CTSS were higher in severe COVID-19 when compared with mild cases. All patients exhibited signs of significant systematic inflammation, including increased level of C-reactive protein, CRP, erythrocyte sedimentation rate, ESR, procalcitonin, chest CT score, and a decreased lymphocyte count. Chest CT score has positive associations with white blood cells count, CRP, ESR, procalcitonin, and abnormal coagulation function, and a negative association with LY count. Treatment with a glucocorticoid increased the LY count, reduced the CT score, that proves coagulation function. So lastly is a note that initially we use RT-PCR test for diagnosis, but according to the patient's condition, we should go for further tests, which are as follows, like CBC, LFT, RFT, CRT, ESR, chest X-ray, D-dimer, S-ferritin, LDH, IL-6, and HRCT chest. So this was all about the diagnosis of COVID-19. Thank you so much.
Slides visible hai kya?
Yes.
Okay. So today my topic is on continuation of diagnostic characteristics. So what are the characteristics or diagnostic features of COVID-19 that makes it different from other coronaviruses? Maybe already so many of us know that this is not just one coronavirus, that is COVID-19. There are, other than this, 6 already strains have been identified till now. So I think we should all know that what is the differences between all the strains of coronavirus, so that whenever any patient comes with us, then we will be able to identify that is COVID-19 or some other virus. Okay, so what are the different strains of coronaviruses? So these are the 7 strains which are written here. So out of these 7 strains, the 4 strains, that is 229E, HKU1, OC43 and NL63, these are very mild and very moderate kind of strains and causes symptoms like runny nose, sore throat, headaches, cough, and low-grade fever. As we can see in this picture, if this is visible, so on the left hand side, the strains of coronaviruses are there. That is these 4 strains. So these 4 strains causes only mild and medium symptoms, while COVID-19, as we can see nowadays, causing mild, medium as well as severe symptoms. And SARS and MERS, these were the very severe strains of coronaviruses that causes high severity cases. So my today's main concern on the topic will be how this COVID-19 is different from SARS and MERS. I just want to explain about this because when this virus came in our country, it was a kind of confusion that maybe this is SARS or MERS because they have high mortality rate at that time. So we should know that what is the difference in these 3. So first of all, a brief introduction of what is SARS-CoV, that is CoV means coronavirus. It appeared in China in 2003. It causes SARS, that is severe acute respiratory syndrome, with the symptoms fever, cough, shortness of breath, diarrhea, etc. MERS-CoV, that is Middle East respiratory syndrome. So the name already suggests us that it affects mainly the Middle East countries, and that's why the name is MERS-CoV. Appeared in Saudi Arabia in 2012, and the symptoms are almost the same: fever, cough, shortness of breath, etc. So now, before coming to the clinical differences, that how they are different from each other. So first of all, I want you all to know what is the basic difference between all these 3. So coronaviruses are divided into, actually coronaviruses are there in 4 genera, that is alpha, beta, gamma, and delta coronaviruses. Out of these, the beta coronavirus is still, is further divided into A, B, C, and D lineages. So COVID-19 and SARS-CoV are lineage B beta coronaviruses, while MERS-C is lineage C beta coronavirus. If we will see the sequence identity, we can easily see here that the SARS-CoV shares 94.6% of sequence identity with COVID-19, and MERS-CoV shares only 40%. And this is the reason somewhere that why COVID-19 is also called as SARS-CoV-2, because of the similarity with the SARS-CoV virus. Intermediate host for COVID-19 is still not known. While for SARS-CoV, it was considered as civets. Civets are a kind of mongooses. And MERS-CoV are the dromedary camels. These are the camels mainly found in the Arab areas. Mortality rate for COVID-19 is 4.2%, while for SARS it is 11%, and for MERS it is 34%. So we can easily see that the most severe strain of coronaviruses that came till now is the MERS-CoV. And comparatively, COVID-19 is less severe. Receptors for COVID and SARS is ACE2, and for MERS-CoV it is DPP4. So now, as we can see in this picture on the left hand side, here I have shown a picture of transmission. That is, the originating host is considered as a bat, and then the intermediate host for SARS-CoV is civets, MERS-CoV is dromedary camels, and for SARS-CoV-2 it's still not known. The common host is the human being, and then the person transmitted to the whole community. On the right hand side, I included this picture because I just want you all to see that how this MERS-CoV is different. I mean, how this MERS-CoV is more severe as compared to the COVID-19 cases. This is a data from March-April 2020. So there are lots of changes after that. Okay. So now, what are the common symptoms? So from this slide, we can easily see that COVID-19 shares lots of similar symptoms with the SARS-CoV and MERS-CoV. So actually the differences we can see here that in a particular strain of virus, a particular symptom appears more in a number of population, and a particular symptom appears less in a population, and that also makes a kind of difference. So in COVID-19, we can see that of course, they all, fever, cough, dyspnea, sore throat, these all are the symptoms which are shared in a very similar scale in all these three viruses. But here, which are highlighted in red, they show some kind of differences, like dizziness and confusion is found in 25% cases of COVID-19, while in SARS-CoV it is just 4 to 10%, and in MERS-CoV it is only 5.2%. Similarly, nausea and vomiting, it is 5% in COVID-19, and comparatively it was higher in SARS-CoV and MERS-CoV. Then in a continuation, if we will see the laboratory findings, then we can see that leukopenia is 35% in COVID-19, while in SARS it is 19%, and in MERS it was 14%. And thrombocytopenia is only 10% in COVID cases, and 48% in SARS and 40% in the MERS. The most important is that when the MERS arises, the most basic complication in the MERS was acute kidney injury. The acute kidney injury is a complication that appears in only around 3% of cases in COVID, while in the SARS it is 6.7%, but in MERS it is 50 to 55% of people suffered from acute kidney injury as a complicated stage. Okay, so now the detection rates of SARS-CoV-2, SARS-CoV and the MERS-CoV. So from this slide, we can see that here on the left hand side, the sample is written. So now I'm gonna explain you about from where we will find a particular virus in much amount, and if we will take the swabs or some different samples, then how we will explain that where these viruses are actually present and from where we can detect them. So first of all, if we will see URT, that is the upper respiratory tract, time of illness only 7. We will see if within 7 days in throat swabs 50% and 100% is COVID-19 is present, while comparatively MERS-CoV and SARS-CoV are not so present, because if we will see in the LRT, that is lower respiratory tract, they are almost nil and absent in cases of COVID-19, but they shows 100% of presence in the throat swabs in MERS-CoV cases and 100% cases in NP aspirates in SARS-CoV. Then same we can see in others also in the blood sample, urine sample and stool, and by this data we can easily estimate this, that mainly MERS-CoV and SARS-CoV were the viruses of lower respiratory tract, while the COVID-19 is a main virus of upper respiratory tract. Okay, so now the CT findings, CT scan findings. So the main finding that we can see in CT finding is the ground glass opacity. This is a very common finding which is present in COVID-19, SARS as well as MERS. That is in approximately 80, 86, 81%. Now, but the differences that came is that we can found bronchiectasis condition or interlobular thickening mainly in the SARS and MERS cases, while this is present almost in a 0% in COVID-19 cases. And also we can see here that peripheral distribution is very common in SARS and MERS, while central distribution is more common in COVID-19 as compared to SARS and MERS cases. Now, the nucleic acid test. So what are NATs? So NATs are widely considered as the optimal method of specific primers and standard operation procedures established during the sequencing of the total genome. So some of the part, and of course most of the part is covered by the speaker number 3, but there is just a basic information about this, that RT-PCR is the most preferred and widely used NAT method. The RT-PCR come under NAT method. So the main targets of this RT-PCR is the ORF1A, ORF1B. So exactly what are these? S gene, M gene, N gene. So ORF means the open reading frames. Okay, so open reading frames simply means the part of the DNA or the RNA that actually gets translated. Okay, so these are the open reading frames. Now the S gene and M gene, what are these? So we can easily see in this picture here that they all are the precursors actually. So M gene is a membrane protein. It is a precursor of the membrane protein. S gene is a precursor of spike protein, and N gene, that is nucleocapsid protein. Okay, so RT-PCR is a very wide method, and the RT-PCR for different strains varies in genome target, assay use, sequence, etc. Now, as this COVID-19 is a very new virus, and so many of us don't know exactly about it because the researches are still going on, but there are some facts that we can conclude from all the information that we get until now. So first of all, SARS-CoV-2, the COVID-19 means, is more phylogenetically related to SARS-CoV than to MERS-CoV, because of course they share lots of sequence identity with each other. Only minor differences have been found between genome sequences of SARS-CoV-2 and SARS-CoV. Okay, then the SARS-CoV-2 means COVID-19 affinity for ACE2 receptor. When it is researched, it is found that for the affinity for the ACE2 receptor, this COVID-19 is more higher as compared to that of the SARS-CoV. The fatality rate in COVID-19 is lower than that of found in SARS and MERS. Of course, we can see from that picture of the mortality rate. 1.2% of COVID-19 cases are asymptomatic. Maybe more than that, this is just an estimation. So as we can see, lots of cases appeared in COVID-19 as asymptomatic. COVID-19 is not very different from SARS-CoV and MERS-CoV regarding the demographic characteristics, laboratory and radiological findings. Okay, and that's why this was the confusion when this virus came. But after researches, it came to know that this is a different and new strain. Clinical complications in COVID-19 are as frequent as in SARS, but less frequent than in MERS. So if the clinical complication will occur, then it will occur in a more severe case in the MERS, but the thing is that it is less frequent as compared to COVID-19 and SARS-CoV. And COVID-19 RNA has been detected in the stools of detected patients, similarly to SARS-CoV and MERS-CoV. So these are the odd similarity and differences between all these 3 strains of coronaviruses. Thank you.
विजिबल है ना?
Yes.
Here I am presenting the clinical symptoms of COVID-19. This is the continuation of diagnostic and characteristics. Clinical symptoms of COVID-19. Most common symptoms: cough, fever, shortness of breath, sore throat, headache, runny nose, tiredness, muscle pain, diarrhea, loss of smell, loss of taste. Symptoms may appear 2 to 14 days after exposure to the virus. Effects on CNS. CNS पे क्या इफेक्ट करेगा? तो symptoms आएंगे इसके headache, dizziness, encephalopathy, anosmia. Anosmia the loss of smell, seizure, epilepsy. Symptoms of COVID-19 on respiratory system. Respiration, coughing and sneezing, runny nose, shortness of breath, breathing difficulties, and sore throat. Severe cases में pneumonia, severe acute respiratory syndrome, lungs inflammation and congestions. And GI पे क्या effect होगा? Nausea and vomiting, burping, anorexia, loss of appetite, abdominal pain and bloating, or diarrhea. Effects on excretory system, decreased kidney functions and kidney failure. फिर ये स्किन पे भी इफेक्ट करता है, तो क्या सिम्टम्स अपेयर होंगे? acute urticaria and chicken pox like blisters, dengue like rashes. Thank you.
Okay, so that is it, है ना? सबका presentation हो गया. Okay, Gulnaz, you can stop recording. We can